Hello, everyone. Welcome to the ABEM speaker series designed for program directors and coordinators. Today's session will focus on the structured interview component of the oral certification examination. I'm Angie McGough, a member of the ABEM staff, and I'm here to help facilitate today's session. There will be a brief slide presentation and time to answer any questions that you may have about the structured interview. The chat feature has been disabled, so please put your questions in the Q&A section at any time during the presentation, and we'll get to the questions after the presentation is complete. Please join me in welcoming today's presenters, Dr. Kim Feldhaus, ABEM Director and Vice Chair of the ABEM Test Administration Committee, and Dr. Deepi Goyal, ABEM Director and Chair of the ABEM Test Development Committee. I will now turn things over to them.
Hi, and thank you so much for joining us. We think it's really important that we talk about the structured interview case, which is what we're going to be talking about today. And we'll be talking about how it's different from other cases that we've been giving before, as well as why we've developed this case type. And then most importantly, we really want to spend some time answering any questions that you have about the structured interview. So just a little background. We started administering this structured interview in 2020 when we pivoted to the virtual oral exam and we used the structured interview as a replacement for the triple patient encounters because it wasn't feasible to administer those virtually. This case type was developed to assess a candidate's ability to synthesize information and develop action plans around their presumptive diagnosis based on that information. As we were developing the format and its rubric, it was clear that this provided a window into skills that we previously weren't able to assess. And a lot of those skills really reflect the complexity that is emergency medicine, including navigating uncertainty and communicating critical information to patients and the healthcare team. It's very different from the standard cases that we've been using for the oral exam in the past, where candidates manage patients by role playing. The structured interview does not involve role play, and it's similar to the interactions that attendings have with residents every day. The structured interview case approaches patient cases with a systematic interview. So far, the virtual oral exam has consisted of one structured interview and 6 standard cases. Starting this year in 2023, test takers will have 2 of their 7 cases be structured interviews, with the remaining 5 be the standard cases. Each of the cases are 15 minutes and the examiner manages the time, but candidates need to listen to examiner cues to move along. At the start of the case, the examiner will identify it as a structured interview case, as opposed to a standard case for a single patient encounter. So the goal of the structured interview is to assess a candidate's thought process and their ability to optimize healthcare outcomes by synthesizing the available information that they have about a patient or scenario, identifying data that would guide the management and diagnosis of that patient or scenario, and communicating critical information to patients and others across the healthcare spectrum. Typically, cases are broken down into sections that are dynamic. So every case is not going to be the same, but many of the cases will include areas such as the history, the physical exam, developing a presumptive differential diagnosis, obtaining diagnosis studies and identifying which ones would be most helpful in managing that scenario, developing treatment plans, identifying a final diagnosis and disposition, and then facilitating a safe transition of care to either the healthcare team that's going to be managing the patient after the emergency department or with the patient to help manage their care after their emergency department visit.
Thanks, Deepi. In order to ensure that all candidates have a fair testing experience, the structured interview is going to utilize a level setting aspect such that every candidate will be provided with the same information from the examiner, unlike in a standard case where the information you receive may depend on how you role played. In the structured interview, every candidate will receive the same information as they progress through the case. So for example, during the case play, the candidate might be asked what specific data they would want in order to narrow their differential or in order to manage the case. After they have expressed what data or information they would be interested in, all candidates will receive the same information back from the examiner. They may receive information that they asked for, that they were interested in learning about in order to manage that case. They may receive information back from the examiner with respect to information that they had not asked for. So it's important that the candidate recognize that at that point, they need to take the information that they have been provided and then continue to move on and progress through the case and to manage the case. The scenarios, for the most part, will involve an individual patient, management of an individual patient, but the SI can be quite diverse, and you may find yourself having cases that involve multiple patient encounters or other scenarios that would be commonly seen in emergency medicine. How are these structured interviews scored? They are assessed based on the critical actions that the candidate has achieved. So the candidates are assessed whether they are identifying certain critical actions that a clinician would need in order to narrow the differential or to manage that particular patient or to risk stratify particular conditions that the patient may be presenting with. They may also be asked questions regarding why they wanted a particular historical piece of information, how a particular physical exam finding would be helpful to them, or their thought process around treatments that they would recognize need to be utilized at that particular point in the case. The key point, as Dr. Goyle had already mentioned, is to remember that these cases are really meant to test the ability of a candidate to synthesize data and to recognize key information that would be responsible and be helpful to guide an individual in caring for a particular patient. In order to prepare for these SI cases, a candidate should really just have a broad understanding of the different types of scenarios encountered in emergency medicine, and also to be able to articulate how they would work through a particular case or a particular scenario. As has been mentioned, in many ways, it may be similar to how residents are interfacing with attendings in presenting particular cases, talking through what their thought process was with respect to gathering data and then managing that case. You're still in.
Thank you. As Dr. Feldhaus said, this test is not trying to trick the candidates. They should really be practicing the skills they use every day as they listen to their examiner's prompts and respond, oftentimes with lists that reflect how they would gather and synthesize information to actually manage a patient or a scenario in the emergency department. So again, it's not meant to trick candidates, but really is a reflection of the skills that they're learning through their years of training to master emergency medicine. And there's a lot of information available at the ABEM website, and you can get sample case materials as well as a video that reviews the structured interview there. So I really encourage you to go there yourself and encourage the residents as well as other program leadership to visit the site, because there's a wealth of resources there. So with that, we'd be happy to answer questions.
And while we're waiting for people to put their questions in the chat, we do have a couple of questions that came in prior to the session. One of the questions that came in was, how is the SI case scored? Is there a scoring rubric?
Well, I'll start by saying that it is scored really based on those critical actions that we mentioned. So the rubric would be, in many ways, a yes and no. Did a particular candidate indicate that they thought a particular historical piece of information was helpful for them to manage this case or not. And as Dr. Goyle mentioned, on the ABEM website is an example of a score sheet, so you can take a look at that and see the types of critical actions that we're interested in, not only actions or indicating particular data that you would like to gather, but also your thought process behind why a particular piece of information would be helpful or why an action would be indicated at that point in the patient's care.
Yeah, and it might seem subjective, and there's a question in the chat as well that that addresses objectivity around this exam type. I would have to say that I really feel this is a lot more objective in many ways than the standard cases are. It's different. We use a panel of really experienced emergency physicians to identify, what the critical action should be as we go through a case that reflect really the diversity of practices across the country. So we're developing critical actions that shouldn't be regional, but really reflect the best emergency care for all patients. And so I can say with confidence that the critical actions developed are very objective and the scoring is very objective, despite the fact that for a candidate, it might feel as though it's a very subjective discussion, similar to what they have in the emergency department.
There's also another question. Will there be structured interviews where the examinee will be treating multiple patients?
Kim,
do you want to take that as part of the BCI?
Yeah. With specifically to answer the question regarding whether there'll be scenarios where a candidate will attend to multiple patients, I don't know if I can speak necessarily to the specifics of what the scenarios will look like. As we did mention, the SI cases are quite diverse, and there may be single patients, there may be multiple patients, there may be other scenarios. But also, I think it's important for you all to be aware and to weigh in, if you would like, to ABEM's Becoming Certified initiative, which we have been undertaking for the last year or so, where ABEM is really taking a critical look at the steps required in order to become certified, including what the oral exam should look like. I don't know exactly what the next couple of case types will be developed may look like, but I think that we may be seeing some changes coming forward that would reflect how we believe is best in order to test and to ensure that candidates taking an oral examination are really being tested on areas of emergency medicine that we've not been able to assess thus far, areas of emergency medicine on an oral exam that may be beyond their clinical knowledge. And I know that as the test development chair, Dr. Goyle may also have some comments with respect to that.
Katie, I think you answered that perfectly. I mean, it's absolutely true. We're really trying to use this exam type to assess the broad range of skills that emergency physicians need to have, including and not limited to managing multiple patients. So while none of the scenarios to date have had multiple patients, I would expect us to explore using it for other skills that we haven't previously assessed, including multiple patients.
Okay, one other question that we have is, it seems that taking the structured interview case, candidates could conceivably run out of time. Do you find that people have enough time to finish the structured interview cases?
Yes. As we've mentioned, the examiner will help manage the time and will move candidates through the different scenario or the different aspects of the case. There is a little bit of joint responsibility in that a candidate perhaps should recognize that spending minutes and minutes and minutes gathering a history, for example, and mentioning every single possible type of historical point may not be realistic and may not be what they really would do in the emergency department with respect to trying to expeditiously narrow down their differential and take care of this patient. But for the most part, 15 minutes is enough time. And again, the examiner will help to move those patients through the case as needed.